Weightlifting on the expander. A few weeks ago, these kind of arm movements were still unthinkable for Dirk Ensmann. Severe pain, a severely restricted mobility of the elbow and paralysis in the fingers, all due to an operation of the arm after breaking it. I type with 10 fingers, which is just one example, not to mention other things like playing the guitar or piano. I can also no longer work in my profession since I cannot probably use my hand. This brings with it many limitations. Just having had elbow surgery, the 50-year-old criminologist again visits a doctor. This time a neurologist, because paralysis is usually treated by these kind of doctors. He does the current standard examination, a so-called EMG. But he still cannot find the reason for a paralysis. Until recently, the diagnostic methods in the neurology department were exhausted. This led to absurd surgeries or lifelong damage due to non-treatment. In that case, you really worry that the damage will be permanent. But Dirk Ensmann is lucky. He finds a second doctor who can help him, Dr. Henrich Kele. He uses a diagnosis of peripheral nerve damage, which means the damage outside the brain and spinal cord. A new, so far rarely used method, the nerve sonography, which is better known as the ultrasound. This way certain anatomical features can be detected before surgery. And above all, the causes of diseases of the peripheral nerves can then be discussed. For patients, the nerve sonography offers a big advantage, because with it often tedious, unrecognized diseases can be detected. Ultrasound is a simple, well-known method. For the detailed study of nerves, the doctor needs an ultra-modern, high-resolution ultrasound machine with a high-frequency transducer. With this, the entire course of the nerves and surrounding tissues can be perfectly shown. This is a milestone for the treatment of neurological disorders such as pressure damage, nerve tumors, inflammation or nerve injury due to accidents and surgery, which is what Dirk Ensmann suffered from. Dr. Kele found out by an ultrasound examination that the hobby musician suffers from a nerve that is compressed by a bony proliferation, and it is jammed. Meanwhile, Dirk Ensmann has been successfully operated on, growth were removed, the nerve was exposed. Finally a happy end in a long story of suffering. A long enduring nerve compression can lead to the fact that the nerve never recovers and there's irreversible nerve damage with consequences such as paralysis, sensitivity, disturbances and other things. The neurologist from Hamburg therefore calls for increased nerve sonography education and the increased use of high-quality ultrasound equipment to study nerve damage. Since the exact diagnosis and especially after the operation, Dirk Ensmann has been making great progress, both mentally and physically. If you have a diagnosis, if you know what the situation is and what has been done, and if I can predict what will happen next, I feel safer and more comfortable. Before the surgery, an elbow flexion of 90 degrees was possible. Now after surgery we have been able to reach 130 degrees. This shows that the surgery was a great success. Thus Dirk Ensmann can bend his arm almost as much as a healthy person. Additionally, the paralysis in the fingers is almost gone. Now the 50-year-old hopes to soon return to playing piano and guitar.